All right, let's get to the latest medical news about COVID-19. Our friend Dr. David Winter from Baylor Scott and White Health joins me. And good morning, Dr. Winter. Good to see you again.
Good morning, Sonia. Good to be back with you.
I want to talk back to school, but before we do that, I just read a story about how this baby may have contracted coronavirus from the mother in the womb. And do we know anything new about vertical transmission? I mean, from what I understand, these are very, very rare instances. I just don't want to freak anybody out.
Well, that's a very good point. And last I looked, there were 100,000 live births since COVID came out. And this is the second one I've heard of. So it's very, very rare. Fortunately, the mother and the baby are both doing fine. But just to reassure pregnant women, it's very uncommon, highly unlikely it'll happen to them.
Okay, thank you for putting that into context. Now, when it comes to back to school, we've got some kids starting at home, some kids going back to class, parents and teachers wondering how to keep everyone safe, including themselves. What do you think is the best practice for people who do have to send their kids back to school, who do have to go back to work in these environments?
Yeah, be concerned for lots of parents, Sonia. So a couple points to be made. First, children rarely get very, very sick. They have mild or no symptoms. Now, if your child has severe asthma, cystic fibrosis, anything that lowers your immunity, watch those kids, be very cautious with them. But most kids do fine. Of course, those kids can be vectors and bring it home to parents and grandparents. Important to make that point to them. So they need to be very careful. They need to be taught masking, distancing, disinfecting. In fact, I think it's a good time to talk about social responsibility, personal responsibility. They themselves can help slow the spread of the virus if they do those three things.
So let's say a kid goes home to grandma or grandpa's house or whatever. Would you suggest wearing masks even inside the home?
If there's a concern, yes, particularly if grandma or grandpa has some underlying condition, that's a safe way to do it. Some talk about maybe should they take a shower and change clothes. No evidence for that yet. I mean, it's not a bad idea. I'm not sure that's important. But no hugging and kissing, and keep that distance. I think that's very important, Sonia.
That's so hard for grandparents. Let's talk sports now, because a lot of these kids, well, really, I say kids, but up into, the college sort of athlete age, are starting to go back into, drills and practices and things like that. And there's a lot of sort of closeness when it comes to sports and practicing. What are some of the suggestions that you have or recommendations you have if you've got a kid in sports for some of these parents?
Well, especially contact sports, football and basketball, that's going to get spread if they get it. Now, testing can help, but let me make a point. So an athlete, student athlete, gets a corona test, it's negative. So that day he goes out or she goes out and parties, the next couple days that can be spread to the rest of the folks. So I think kids need to be very responsible themselves. It's not practical to test every person every single day. But a test is negative, it's only good for that one day. So they need to especially avoid crowds, distance, mask. It's a big deal right now with sports. We want to play sports. It's good for the kids, it's good for us to watch, but they need to be especially cautious if they're a student athlete in a contact sport. Golf and tennis, not so much.
Okay, good to know. And I'm glad you mentioned testing because, we're seeing, continuing to see numbers, even some, children's hospitals releasing numbers. We're seeing like a pretty sharp decline in the number of kids testing positive in particular. And so what does that tell us? Is that a reflection of the number of people getting tested or something else?
Yeah, it's really hard to know, Sonia, because right now we don't know the true infectivity rate, meaning how many folks in the population, in the community actually have the virus. If you look at the folks who are the sickest, the ones in the hospitals, those folks can kind of tell you that it's come down a little bit, but not that much. We need more testing, more contact tracing before we actually know for sure. In the meantime, I think it's best if we all assume that somebody out there has got the virus in a crowd. Maybe somebody who's a close friend has got the virus, so be careful. Our only defense against this virus is to prevent the spread of it until we get a vaccine, and that's going to be a ways off, I'm afraid.
All right, Dr. David Winter, thank you as always for your time.
Thank you, Sonia. Good to see you again.